is our second PCORI award. We had one really thinking about how patients could be engaged in our clinical registries. Oh, thank you. And then we had one specifically, and then the thought was, and I'll let Susannah tell this wonderful organic story of how this came together, because it really was her work, and it's just very gratifying. But we'll talk about how this came together, and we're now at the point where we have tools that we'd really like to start rolling out to our community and some workshops. So briefly, all three of us have nothing to disclose. I'm going to walk through briefly some introductions, some context, a little bit of the project overview, the themes and scorecards of what came out of this work that Gina will share. Susannah will offer some historical context for us about patient-led efforts, and a big part of what she has done is really understanding peer-to-peer learning and support, the value of what we've been doing, and then some next steps of where we are. So this is work funded by PCORI, as I mentioned. We did this from the start as a true collaboration. We are sharing this award with our patient-led research collaborative team, and have jointly administered it, come up with the approaches, all of it from the beginning. And special thanks to Suzanne Pope for being the project manager glue across our organizations and the project over the last couple of years. So I'm going to do a brief introduction, but then Gina Assaf, who's next to me here. Gina is one of the founding members of the Patient-Led Research Collaborative, and she'll tell you more about that. If you haven't been following the work of the PLRC, it really humbles me to see what these extraordinary women, and they have all been women with long COVID, have done to define the disease and then define how to make themselves better. And even at the point now of getting an opportunity to give out grants of their own to researchers to continue to study it. You guys are tired of me. And then Susannah Fox is someone, former, I think one of the first chief data officer.
Chief Technology Officer.
Chief Technology Officer at the Department of Health and Human Services, and now is a principal of her own consulting group, Internet Geologist, and she's also a key member of our advisory panel. So let me just quickly do a couple more. This is our project team. These are the people in the top row are the other members, core members of the Patient-Led Research Collaborative team. All come to this with unique and special research skills, although not in medicine. For example, Hannah Davis has expertise in AI and machine learning, and I'll let Gina talk more about that. And then thanks to Liz and Susannah, as I mentioned, who've helped bring this through. I'm going to let Susannah tell the wonderful Genesis story, please.
Oh, good.
Yeah.
Thank you. So throw your mind back to, and is this on?
Yes.
Okay, good. Throw your mind back to spring of 2020 when it was just emerging. We didn't know anything about what was going to happen with COVID. And it started to emerge, patient stories started to emerge about how people really weren't getting better. What I do for a living is spend time in online patient communities. I'm like an anthropologist who goes into online communities and brings back stories from the Rebel Alliance of patients. And I act as an ambassador between the front lines of the Rebel Alliance of patients and caregivers, often creating their own solutions, and mainstream organizations. And what I saw emerging online was this alliance of people with long COVID who had started to collect data. They were filling the gap where, frankly, mainstream scientists weren't yet tracking this, and so patients started tracking it on their own. What you need in any kind of change is not only people who are creating change at the grassroots, but you need to have somebody receive it in the establishment, right? And we've heard this afternoon in this room about how to create systemic change. You need, whether you're a group of Rebel Alliance physicians hoping to get your hospital to change or to get the system to change, or whether it's a Rebel Alliance of patients. And this is where I give credit to Helen. I wrote a blog post. Helen saw it. She contacted me and said, please, join our webinar that they were, a webinar series that CMSS was creating, because you can't have a discussion about patient registries unless you have patients. And that's what our webinar was about.
And as a result of that, after the webinar, I wrote Susannah and said, do you think they'd want to work with us and we could get them a PCORI award? And that was literally where we went to next. So it was a wonderful, that webinar, it was extraordinary. It's still on our website on our COVID-related webinar series. But this ability to bring patient-led research together with specialty societies who really value scholarship and research, but in such a different way. Our prior efforts, our prior PCORI award was really about how, for example, specialty societies could get a patient on your board, a patient as part of your research efforts. This turns this completely on its head, and it's not about inviting them to your table, but instead joining tables or being invited to their table. So very much innovative, new way of thinking about this. And just briefly, this is who is on our advisory panel. We've been really blessed. Many of your folks across your societies have been willing to engage with us as part of these efforts. It's more than 50% patients. And of the physicians who are there, a fair number of them actually are long COVID folks who specifically specialize in long COVID. So I'll do the goals, and I'm going to pass it over to Gina to share some of the early work and findings we've done so far. So really the goal here was to support patient-led outcomes research and think about how this patient-led research and patient-generated outcomes data fits into this broader milieu of the clinical and research enterprise around clinical effectiveness research. Since this is PCORI, we want to collaborate with diverse patient populations, think about how different it is when patients lead these efforts, as I mentioned, and then think about a really important piece of this is, and it was fascinating, I have to say, working with your team over the last couple of years, at every visit, at every one of our calls, we didn't know who was going to feel well enough to join us. And so just thinking about the sustainability of working with patients who come to the table with the illness is also just something that's been incredibly important, as you'll hear in some of the scorecards. We've had some lessons learned from this research, and we've got a draft nested playbook that's on our website that we'll continue to update with some of the just rich materials and skill and scorecards that Gina and her team, with our help, have put together. I think I'm turning to you.
Yeah.
Yes? Do you want to just sit there?
Yeah, is that okay?
Perfect, absolutely.
And can you all hear me okay with the mask on? Okay,
Yes,
great.
no worries.
Thanks, Helen and Susannah, and the whole CMS team. You all have been awesome, and really appreciate bringing us together and realizing the power in that. So I'm Gina Assaf, and I'm co-founder of Patient-Led Research Collaborative, and co-leading this project with other PLRC co-founders and the CMSS team. I caught COVID in March of 2020. And have been suffering from long COVID since then. So it's been over 3 years now. And actually all of our teammates, and so we have about 50 people in our group who are, a group of patient researchers and advocates across 4 continents. We met and formed in a long COVID support group. We all have varying degrees of long COVID. Some of us are bedridden. Some of us, for example, I have to sit down majority of the day. Different kinds of levels and severity of symptoms. But what's unique about us, and I think that's been super powerful, is that we're an interdisciplinary team. I come from a background of technology design and research, working in the global development sector. So I bring in some research background, but it comes in a very different area of research. We have MDs in our group. We have biomedical researchers who had to quit their jobs because they weren't able to, work in the 8 to 5 regular workday. We have artists. We have, all sorts of disciplinaries bringing together their skill sets and most valuable, their lived experience of long COVID. And we have produced, thankfully, and I don't know how, but I've worked 10 papers in the past 21 months. 3 of them we actually led. We also have informed policy guidelines on long COVID, worked with WHO, with the CDC, to influence, how they're defining long COVID and treating patients. We also influenced NIH 1.1 billion funding that has been under the Recover project currently. And we most recently, which Helen brought up, was our funding that we got from Balvi Foundation. They granted us for $4.5 million, where we actually re-granted to biomedical research for long COVID, but it was decided by a panelist of all folks with long COVID or post-viral illnesses. And that has been so super powerful in itself. We actually are also running our own research with the reinfection study, looking into qualitative research of LMIC, what's happening in LMIC countries when it comes to long COVID. There's not much literature on that. So we're looking in a lot of different areas that all of us as patients have interest in and kind of want to bring to the table. So yeah, we can move on to the next slide, Helen. So we got involved in this, in this project, we started out, so we looked at this in two ways. One was we got to reflect on the work that we had done. Now, we came together in a unique situation. A lot, people with different expertise getting together, all having the same illness at the same time and collaborating online in a Slack group. And we were able to produce the first research that went out there. And we reflected on what we did together and try to understand what went well and why did this work? Why were we able to get published in a medical journal as patients? What was right about our process? What can we document that can be a learning lesson for other groups? And what were some pains as well? So we recorded that. We also got some input from the rest of the group in terms of what they thought we should focus on in the research. And we got different axes and areas that we were going to focus on for this project, because this was looking into a more higher level of patient models and patient-led research models. And then on the I think it's your right-hand side. No, you go back. And it's okay if you get back. Yeah, the right-hand side was where we knew we weren't the first who had done patient-led research. There are so many other groups and other success stories. And so we wanted to go back and talk to those folks and understand what they had done and learn from their experiences and document it and kind of compare it to our experience. And so that was the synthesis of all our work. We used a tool called Miro, which we use actually in tech quite often, to kind of document and synthesize our work in a way that is visual and can lead us to a model that we can share. So we can go to the next. The following is a few quotes from our key informant interviews. They all are pretty powerful ones. These are just a few of them, but these are ones that maybe tie into our key findings. The one on the right-hand side, which talks about the biggest barriers of research when you're a patient coming in to talk about your research, whether it's documenting it in a survey or talking to somebody about it, is the trauma that you go through. And so this was something that we heard this from somebody else, not from our group, and it was such an aha moment because we had, in our own surveys, had put in a lot of ways for people to take breaks and to think about not to overburden themselves because we knew that it was bothersome to us, but to hear it documented in a way that we hadn't thought about it was really something else. And then the one in purple, which is also super interesting, where some patients told us that some of them had actually been researchers in their career or had major accomplishments in addition to, of course, their lived experience. But to other researchers, especially in the medical research community, they were always considered a patient. And this to us spoke to the power dynamics that exists between a patient and a researcher and how that may end up compromising the research, in our opinion at least. And so, yeah, there's other quotes y'all can read. I'm not gonna, go through it, but I think, we got some really interesting, insightful quotes from many participants. You can go on to the next slide. And so, in summary, the key themes that came out of this research were summarized in these 5 bullets or 6 bullets. But, important to think about the motivations of involvement and the biases. People talked about how patients have biases, but researchers in them have biases themselves. They come into it with certain motivations, and it's, I would rather have the biases of a patient who wants to get better, versus, or, just looking at all the biases. And then the power dynamic in collaboration, which I talked to earlier. The theme of thinking about patient-empowered versus patient-led. What is that? What is the difference? And, and is one, better than the other? And can we have both? So, that was definitely something that came out. And then empowering the patients to lead and move away from problematic dynamics that exist. We also went into the skill sets, right? Of course, in research, you need to have some hard skills. And how do you train patients who are coming into the research world and may not have those hard skills, but then also the soft skills to engage with groups. And then lastly, Thinking about, this is more around, I think, the funding, and if you got funding from different groups, how do you sustain yourself and keep the autonomy and your moral alignment and that sort of thing. So these were the key themes that we moved into as we developed the scorecards. We can move on to the next. And then, thinking through the scorecards, the reason why we ended up going with the scorecard is we actually evaluated many different models. We did literature reviews, and we wanted something that was simple, can be deployed, by the end of our project, and was actually action-oriented. We didn't want to just come out with just material that was, for reading. We wanted it to be something that you could use as a researcher, as a patient group, as a funder, and we wanted it to be something that could be built upon as well. And so the scorecard surfaced as our, the best option for this project. So this is what our scorecard framework was. So we looked at, the scoring number, like how do we go about scoring? So we thought about this very, deliberately, to put negative and positive on both ends. The ideal collaboration would be a 2, which would be the patient-led model and patient-centered or more towards the lead. And then non-collaboration would be more around somewhat tokenizing of patients and patient feeling burdened by their participation in the research. And then we took each of the dimensions that we focused on, and you can see that in purple, and we talked about, what is the ideal engagement that's like patient-led, what is minimally acceptable, that is maybe leaning towards patient-led but is not there yet, and what is not acceptable as a patient group or as patients, being involved in research or wanting to follow this model. And we defined this in a qualitative way and as we started our work. And I'm not going to go through all our scorecards here, but here's an example of the research partner readiness. You'll notice we have the scoring on the top, and this is the light blue is the sub-dimension. So with each scorecard, there's like a sub-dimension. So here you have recognition of biases, the collaboration process, the knowledge in the subject, in the disease subject. And so, we go from the -2 to the 2 for all of these sub-dimensions. And then we would score the research partner based on this. So we can go to the next one. I mean, we have a few here. I don't think I need to go through all of them, but the patient burden one was one that we as PLRC were super passionate about, and because we felt like it was something that we personally dealt with, and we iterated on this one quite a bit. Yeah, and this is the integration into the research process. This is the most intensive one because we go into different parts of the research. But we can share these for people to look through, right? And then the patient and partner governance was an interesting one. So yeah, we have 4 that we actually, and you can go to the final slide for my section. So that we worked on 4 scorecards, and they're in a semi-final version. We're going to continue to iterate on these. They're ever evolving. We were able to do more testing and more iteration on the patient burden one. However, we're looking forward to seeing these scorecards implemented and getting feedback on them. And we want these to be a dynamic tool. We see this as just a stepping stone into them being leveraged and used and iterated on further. So yeah, it's exciting.
Great. Susannah.
So what we also wanted to bring is a historical perspective that this is radical and yet not new. Throughout the 20th century, we have examples of patient-led, peer-led, survivor-led campaigns to contribute to research, to save people's own lives, from the founding of AA in 1935 to the groundbreaking work of ACT UP and other HIV/AIDS activists in really changing how discovery and regulatory structures responded to HIV/AIDS. There's a saying, don't let a crisis go to waste. And that's what I think we're doing with COVID. And we have to retool to anticipate the crises of the future. And frankly, the gift of the donated time of the PLRC is a model that everybody can learn from. And again, it goes with the theme of the conference, that we're stronger together, that a community coalesces around a problem and solves it together. And What I also love about the long COVID patients is that they honor the ME/CFS work that's gone before. Post-viral illness is not new. It's just at a bigger scale, and we're all paying attention.
Yeah. Completely agree. Is this one yours as well?
This is me too. So again, what I wanted to say is I want to honor, this is a memorial on the National Mall of COVID deaths. And we mourn the deaths from this virus, but we also honor the millions missing of people living with post-viral illness. And this is our opportunity to look at what the PLRC was able to accomplish, look at how CMSS was able to partner with a patient group and bring this not only to long COVID, but to many disease states. And I think you're going to be surprised when you take a look at the scorecard. What I see is that this is going to actually be a competitive advantage for researchers and clinicians who want to go further, faster, with patients as partners.
Yeah, I couldn't agree more. So just to give you a little bit of a sense, this is really just the first preview of this for you. We're going to be doing several webinars as part of this work for PCORI, which the patient-led research team and ourselves will be putting together. So really walking through each of those scorecards, giving you a sense of really how you can use them. Our hope is that this isn't one-sided. This isn't just how the patients evaluate researchers, but really for researchers, how do you think about who are the right patient partners for you to work with, and then hearing from them of what they need to really be integral to the work and move forward. So this has just been, I have to say, an incredible honor to work with this team. And one of our members of our advisory committee, who's now a dean of a medical school, dean of med ed of a medical school, said she learned more in a 1-hour advisory panel session than she had learned all year. It was that kind of depth of learning and deep I think humility that you have taught us so much. So more to come. We'd love your insights and your thoughts. We've got some points of contact here for you, but just want to say incredible thank you to Gina and the team, and of course Susannah for being the spark and the continued energy in this effort. Thank you all.